and the human part. But I want to emphasize something about the visual that you're seeing here on your screen. These 4 dimensions are not a sequence. It's not, oh, first physical, then information, then service, then human. Everything is interconnected. The passenger that has an invisible disability is at the center. This passenger does not experience these things separately. She experiences them as one journey. So the physical accessibility part is asking you, can I access the system? Yes, I'm entering a bus, a public transport system. Am I able to get on physically and all my access needs are provided? The second one is information accessibility. Can I understand the system? When I move from one bus stop to another, are they giving me enough information that allows me to understand the transport system? Do I know where to stop? Do I know what is happening along the journey? The third one is service accessibility. Can this system respond to my needs? If I suddenly have an access need during the journey, do we have transport workers or people within the bus that can support me even though I don't look physically disabled? And then the human accessibility needs is, will the people within the system, will they recognize and respect those needs? Because it's not enough to have rules, to have policies, to have laws. The people that are providing the services, will they adhere to those rules and give me the accessibility support that I need as a person without a physical disability? Let's not forget that we are talking about people whose disabilities are not physically obvious. And underneath all of this is something that I want us to experience, right? Or something that every person with a disability wants to experience. They want to feel safe, they want to be understood, and they want to be supported. So now the shift I am proposing with my paper is that accessibility should move from a checklist and become something that is part of the service ecosystem. We're not doing it just because, oh, the government said we must make our bus accessible. Okay, I tick it. The bus has ramp. The government said that we must do this. Okay, we tick it. This our bus has this. It has to be part of a service ecosystem. That is very important. So now, let me break down all the 4 pillars. The first one, like I said, is physical accessibility. This one is asking us, can I physically access the transport system? And we're talking about the vehicle design, the station and stop design, the network design, right? All of these things are good because globally, the transport system is making a conscious effort to become more accessible physically for people with disabilities. But it goes beyond that, right? This is where the universal design provides an important foundation. This is Ronald Macy's universal design principles. And I would give an example. There's a popular bus stop or interchange in Nigeria called Oshodi in Lagos. In fact, there's a joke in Nigeria that if you're ever lost in Lagos, find your way to Oshodi, you will get anywhere in Lagos. So now let's say this woman that we talked about in my first slide, without a physical disability, but she's also disabled, right? She goes to Oshodi. Now picture Oshodi during the rush hour. Oshodi is a very big place. It's always crowded. And then she gets there, right? She gets to the interchange. There's a BRT. The BRT is the public system that the Lagos State government, public transport system that the Lagos State government has provided. But then when she gets there, normally the BRT buses, they now have ramps. So if you are somebody who uses a wheelchair, there are some buses that have ramps that can help you, get on the bus. But then these buses are usually scarce. What you will get is Danfo. Danfo are yellow commercial buses that we use in Nigeria. And now, these buses have no ramp. They have no lift. It's just a rusting step and something that can just, you just have to jump to enter the bus. This lady can take the step because, or she has to get into the Danfo because that is what is available. Now, she does that. What this is illustrating is something important. Accessibility standards can exist within formal transport infrastructure, but then the passengers' actual mobility needs are still not enough. It means that the mobility ecosystem is still inaccessible. Yes, a BRT bus can have ramps, But what if those BRT buses are not available? What about the most common Danfo, Keke, and Okada? These are the transport channels that carry the most substantial share of the daily trips across Lagos. These things are still inaccessible. So when we talk about physical accessibility, it means that we've not even scratched the surface yet, not just in Nigeria, but globally. Because at the end of the day, when we think of disability, we still think of the physical ones, forgetting that there are people who live with pain, who cannot move from here to here without feeling some sort of pain, and they still have to navigate public transportation. So now my recommendation here is that we need to think about how accessibility standards can extend into the licensing and fleet renewal structures. Every year they bring new buses. You would expect that the upgraded buses will be more accessible than the previous ones, but it's never like that. They usually bring the same old ones, and these buses are never even enough. If we must get it right with inclusion in our transport system, then it means that we must always renew the vehicles to meet accessibility standards. Every new vehicle entering the system has to be part of the solution. It's not just enough that, oh, we provide ramps. What are the global standards for accessibility with transport now? Are we incorporating that in the next set of buses that we're bringing into our country? Are we even enforcing standards on commercial bus drivers? These things are important with physical accessibility.
Hi, Mr. Ra, the time is up, but the next presenter, I think, is not here. So I'll give you 5 minutes to round up.
Oh, okay.
Yes.
Apologies. The second one is information accessibility. It means that can I understand the journey as somebody who does not have a physical disability? When they are calling the bus stops, am I able to understand each part of the journey? Because let's say people with hearing impairment, how are they able to hear when the bus driver is calling the next stop? These things are part of my framework. We must ensure that there's information accessibility. Then the service accessibility means that can the system adapt to my needs? Does it means that can the conductor or the bus driver give me extra few seconds before I come down from the bus? And if you are an African, we know how our commercial bus drivers are usually always in a hurry. Somebody who does not have a physical disability but is constantly in pain, how do they get off the bus? These things are very important. That's the third pillar of my framework, service accessibility. And then there's the human accessibility, where do people with invisible disabilities have to always prove that they are disabled before their access needs are considered? It means that the conductor, the driver, the staff member, everybody that is part of the transport system have to understand that disability is not limited to physical one, and they should be able to help. And we need institutions that would equip all these members to recognize what they cannot see and support every passenger. Now, everything comes back together to say beyond ramps is more about moving from one single method of inclusion to a full experience. That means infrastructure and accessibility must work together to give us inclusive transport. And then to round this up, my recommendation is for transport workers, we must include people with disabilities in the service design. They need to be part of even the kind of buses that we build, the kind of transport system that we create in every part of the world. Then for policymakers too, we need to extend accessibility standards beyond just infrastructure by collecting data around disabilities. For technology providers, for example, we need to design information that can work with people who have invisible disabilities that affect how they process information. All these small changes can add up to a very different passenger experience. Let's not forget that when we design for the margins, it helps everybody. You can be fully able today and tomorrow you become disabled. When the transport system is inclusive, you also benefit from it. You can be strong today and be ill tomorrow, but with an inclusive transport system, you also benefit. That is what universal design does, and that's what I'm proposing with my framework. Let's reimagine transport as a service for inclusive, sustainable futures. This is what the theme of this conference is about. And I see us doing this through sustainability, inclusivity, and technology. Let's constantly think about what service can we improve now. So now let me take you back to the woman we met at the beginning. She looked fine, yes, but then the transport system only knew what it could see. She didn't need another ramp. She needed a system that recognized her, and she didn't get that. That is what my paper, the Beyond Ramps framework, is trying to build. We can build accessible infrastructure, but if the information does not support me as a person with an invisible disability, then it's not inclusive. If the service cannot adapt to me, if the person delivering that service does not recognize my need, then it makes my journey inaccessible. So I'm going to leave us with this. Accessibility begins with ramps, but then inclusion does not. So thank you very much for your time. Thank you for this opportunity. I'm open for us to continue this conversation. I welcome the opportunity to develop this framework further through pilot collaboration with transport operators, or even as a full paper for the Journal of Transformative Transport System. Thank you very much. My name is Mistura, and I'm open to all your questions.
Yes, that's a very interesting one. Thank you so much. Yes, I think that there are people here who have been working on disabilities and are very interested in this, just like myself. And I'll open the floor now for interaction and questions. Yes, I think there is more to talk about.
I'm waiting for that. Can I start, please?
Yes, please.
Oh, yes. Thank you so much, Miss Tura. Thank you. Thank you for this session. Going back to what I said about Mrs. Eunice, I think your personal experience here makes this very, very different, very unique. And you've provided insight. I don't know how to explain this. Like, I could feel that connection. I could feel your story about Oshodi. And somebody who has got hidden disability, even the people with physical disability, the downfall drivers don't even care about them. Talk,
At
at
all.
least if I see somebody on a wheelchair, I can be very empathetic. Oh, okay, well, I will take. But even if I don't see it, so I like this, and I just want us to push it further to really think about it. So what? What do you expect a typical uh, driver to do? Because the whole essence of this conversation is, what are the way forward? If, for example, maybe I will invite you later. I've got a session towards the end with a transport operator, T40. He's also does something on technology. It would be nice for us to really ask them. So if you meet a transport service provider, what do you expect them to do? In terms of training, do you expect them to train their driver to say, ask people? They will tell you, Emmanuel, how many people do we want to ask? Everybody is fine. We can't be asking them, excuse me, are you fine? Is it about having a separate space on the bus? So please help me help them. What are those practical insights you think you will expect from a service provider? Remember, if it's somebody in a wheelchair, we can say, oh, create a space for them. But this is invincible. So how would you talk to them?
Okay, I think the first thing would be that when people create solutions that address the needs of people with disabilities, they never bring people with disabilities into the brainstorm session, into the creation process. And I think it affects even the way that we create these solutions, because we create it as from the outsider perspective without understanding what people with disabilities need. For example, right? Everybody thinks about infrastructure improvements. How do we make the buses, or how do we add more ramps? How do we make it maybe bigger for somebody with a wheelchair to wheel herself in, right? Some of the changes that I'm proposing is it has to start with training. First, training that would be championed by people with disabilities themselves. And I say this because I believe you cannot create something for a community without bringing them in. It means you're only doing it to tick a checklist or to say, oh, we've done this. Let people with disabilities be the ones to lead those solutions. Let them share what they want. And it starts with, that's why I said my framework has 4 components. The physical parts, beyond just having ramps, right? There's also the information part. What are the systems that we're putting in place such that even if the bus conductor does not necessarily recognize your disability, right? There's a protocol in place that tells them that, oh, certain things should probably be asked each passenger. Or, for example, there are countries that currently have lanyard that you can wear around your neck that states that, oh, I have an invisible
Yeah.
disability,
Yeah.
or I have a mental illness. Those kind of things, for example, they were created because they sat down with people with disabilities to
Eh,
come up with those solutions,
excuse me
right?
on
So,
that. Please, somebody will also say you can buy that on eBay. You can buy that on Amazon. So I can also wear it and get free access. So just to
but you
counter that
know
point.
that how many people would want to identify as being disabled? Because even now, even when I tell people that I have a disability, they will tell me, say, God forbid, it's not your
Hmm.
portion, right? So
Yeah,
I don't think that the
I
percentage
get.
of people, they'll say it's not your portion, don't say that. So I,
Hmm.
I think that co-creation is the first step. Let us sit down with people with disabilities, find out their access needs, and find a way around it. It's beyond
Hmm.
the physical part. We need to think about information, get data, collect data together, and build these systems one at a time. I think that's like the first approach. I know everything cannot happen even in a
Yeah,
decade. We have a long way to go. But
that's
with
true.
that, listening to the people that these things affect, that's really the first step before we even start designing anything.
Hmm.
Then from there, we
Yeah.
can go to training, then creation, and maybe
Don't
execution
worry.
later.
We will carry on. I like that your practical example about that lanyard. And I also like the fact that you counter my point, which I think shows how much you are very involved in this. Because this is something I've seen in the UK. I've been doing something on airports. And this is where people say, oh, anybody can buy that lanyard. But I get your point. Not many people wants to even wear it for wearing sake. So it's only
Yeah,
going to be those who really need it
yeah,
that way. Thank you. Don't worry, I will be in touch. We'll discuss this further. Let me leave the
no
floor
problem.
for my honorable track chair.
Yes, thank you very much. Very interesting. Does somebody also have a question before I ask mine? Um, so I think you ended up where I was going to ask my first question regarding the identification. So now you have brought in how we can identify them. And then I want us to build on that. Do you think we also have to classify this kind of invisible disabilities, even when it comes to identification? You see, there are people who have sensory issues like those hearing impairment and that. Then there are those who you said have health issues for which they can't even stand on their feet for long.
Yeah,
You see, and then there are those also who have mental health. That is another dimension. You see, so I think we need to see how in your conceptualization you can also classify them and give proposed solutions separately for them.
yeah,
Okay, because if we put all of them together, it becomes more complicated and
yeah.
difficult to address their peculiar issues. You see, uh, so this is something that going forward you can think about. I'm also interested in this, so I would also link up later and then we see. Yeah,
Thank you,
because
thank
I've
you,
also
thank you
worked on
so much.
disabilities for some time. Yeah,
Thank you. Thank you so much. In fact, in response to your question, within the disability community, we actually have colors that represent each disability. In fact, there's July is called the Disability Pride Month. That's the month where every disability community comes together to speak on their struggles. My organization had some activities last month where we were sharing information, but then we have different colors. So white is for invisible disabilities like chronic illnesses. There's yellow for mental illness. There's, I think, orange for different ones. So we actually break them down, and there are colors that represent each communities. But then I understand what you mean, and I'm also, working on some research papers that would find solutions that would help each community.
great, thank you. Okay, so no question, right? I think the other presenter isn't here. I've asked several times, and it's not yielding up. So we would have to end here.
Thank you. I think
Yes.
we'll have to end there. So, Mistura, don't worry. I will be in touch because I think this is something that can be explored further. I'm sure Dr. Philip can also bear me witness. Most of the studies out there on experience of people with disability are the physical ones,
Yeah.
whereby you can see, you can recognize the wheelchairs, the blind, the even hearing. Again, you can see them. But I'm just looking at some neurodivergent, those who are autistic, those who are disturbed by noise. Imagine
Yeah,
those blaring of horns. Some people will not just go out because they can't stand that
they
noise.
can't. Yeah,
And and we can't really. So I think you are doing a good job to also highlight this. While we recognize disability needs to be uncovered, but again, there are still some deep insight that needs to explore. So I really appreciate this, and I sincerely wish you all the best. I look forward to working with organizations to see how we can push this forward. But I think there's a question for you in the chat, if you can see it.
Yeah, the question is, how will your framework, a minute, let me go back. How will your framework move beyond physical accessibility measures, such as ramps, to address the less visible barriers faced by people with invisible disabilities? And what specific transport service interventions would you recommend?
Oh, okay. Thank you so much for this. It was actually like one of the things that were part of my framework. I broke it down into four. I said there are four pillars. There's the physical accessibility pillar, there's the information accessibility pillar, the service accessibility pillar, and the human one. So now, in terms of solutions, because at the end of the day, people with invisible disabilities, most of the challenges that they face are beyond the physical accessibility. The feasible low-cost solutions that we're thinking about right now is, first, when it comes to the transport operators, right, we need to train staff on non-visible disability. We need to, like I mentioned earlier about the lanyard, we need to start adopting visible self-indication, something that when people see, they know that this person has a disability. And then there's nothing we can do without our policymakers, right? I mentioned in my presentation that we need to extend the standards beyond just infrastructure. Like when we give standards, when we give laws binding, I remember that sometime in Nigeria, even right now in Lagos, we have some laws that tell danfo drivers or commercial bus drivers that this is the particular way that their buses should be. Oh, you can't carry passengers maybe at the door. You can't carry more than two people in front. All of these standards have to move beyond infrastructure. When the laws are in place, that's the first step to actually achieving some of these things that bringing these solutions to life. Then another thing is funding pilots. When I say pilots means let's test these solutions. Let's find out whether these things actually work. And that was why I said that that's why I made emphasis on how we can bring people with invisible disabilities into the conversation. Let's have a practical roadmap that would allow researchers, operators, policymakers, and even technology providers. I say technology providers because, for example, in Lagos, we have this cowrie card system where you preload funds on your card, and then when you want to board buses, you just tap and then you pay, right? Even those technology providers, they have to be involved in the process. Inclusion has to be embedded at every stage of the journey. So what I'm saying, like I mentioned earlier, this framework is something that I am proposing, right? The solutions have to be tested first. We need to do pilots. We need to engage with the communities. We need to collect data. I won't call them solutions that have already worked because honestly, this is a model I am proposing, right? But then I believe that when we bring in the people who are directly affected by these struggles, and then we have policies in place, we have a practical roadmap, and we even embed technology, designing a space for adaptive data-driven tools, right? We can close that invisible disability gap in our accessibility standards. I don't know if I answered your question.
Thank you very much. Yes, I think you dealt with it. So thank you to all of you for joining this session. I believe that we have taken a lot of lessons out of the presentations and points where we can also build on in whatever research we are doing. So thank you so much. And we'll keep the engagement.
That's fine.
Yeah, thank
After
you.
this. Yes. Thank you.
Thank you so much. Bye, everyone. So, Mr. Chair, you can round up and we go for our break. Thank you.
Okay. All right.
Next session will be the keynote speaker, who will be starting at 12:45. 12. When is it? So the next session is 12:55 for the keynote speaker. So we are on break now. Thank you.
Sorry, Professor Mogaji, I'm currently in Sydney. So what time?
Oh, I've not even seen you, but I can hear that voice. I can. Oh, Professor Felix, right?
Yes, yes, thank you very much, Prof. Thank you.
Oh, I know that voice. It's how are you doing, sir?
I'm fine. I came back from the US on Saturday. I was just very sick and struggling. So,
So
but
you too, you brought something from the USA.
I mean, Donald Trump just ruined many things. So